Welcome to Let's Master English Together. I'm Brandy, and I am so happy you are here with us today.
And I'm Jason. Hello, everyone. Whether you are listening from home, on your way to work, or anywhere in the world, welcome. We are so glad you joined us today.
Today's topic is really useful. We are going to talk about how to speak English confidently at the doctor's office.
Yes, going to the doctor can feel stressful, and doing it in a new language can feel even harder. But don't worry, we are here to help you every step of the way.
That's right. By the end of this episode, you will know exactly what to say, from making your very first phone call to the doctor's office, all the way to picking up your medicine at the pharmacy.
Exactly. So grab a pen and some paper if you can, because we are going to go through a lot of great vocabulary today. Take notes, and don't worry if you need to pause and replay anything. That is totally okay.
All right, let's get started. The very first thing you need to do before you can see a doctor is make an appointment. Let's say that word slowly. Appointment. Appointment.
An appointment is a scheduled time to see the doctor. You call the office and plan a specific day and time to go in.
Right, so imagine you pick up the phone and call the doctor's office. The person who answers might say, "Good morning, doctor's office. How can I help you?"
And you would say, "Hello, I would like to make an appointment, please." Very polite and very clear. That phrase works every time. Now, the receptionist, receptionist, that is the person working at the front desk, will probably ask you, are you a new patient or an existing patient?
Right, let's break those down. A new patient means you have never visited this doctor before. It is your very first time. And an existing patient means you have been to this doctor before. Very easy. Then they will ask you, what is the reason for your visit? That means, why do you want to see the doctor? What is the problem?
The reason for your visit, you might say, I have not been feeling well, or I have a pain in my stomach. We will practice describing symptoms in more detail very soon.
After that, they will offer you a time to come in. They might say, we have an opening on Tuesday at 2 o'clock. Does that work for you? An opening means a free available time slot in the schedule.
Yes, that works for me. Thank you. Or you can say, I'm sorry, I'm not available then. Do you have anything on Wednesday?
Okay, so now the big day arrives. You have your appointment and you walk into the doctor's office. What happens next? You go to the front desk. Front desk. The front desk is the area at the entrance of the office where the receptionists work.
Right. You walk up to the front desk and you say, Hi, I have an appointment. My name is, and then you say your name. Simple and clear.
Exactly. This is called checking in. Check in. Check in means to let the office know that you have arrived. You are telling them, I am here. I am ready for my appointment.
Check in, and the receptionist will probably ask you for your ID. ID is your identification card, something like a driver's license or a passport. They use it to confirm who you are.
They will also ask for your insurance card, a card with your health coverage information that helps pay for your medical costs. Always bring both your ID and your insurance card to every appointment. After you check in, they may ask you to fill out some paperwork. Paperwork means written forms, documents that you need to read and complete with your personal information.
One important form is the medical history form. Your medical history covers your past health. Things like, have you had any surgeries? Do you have any allergies? Are you currently taking any medications? And allergies. Allergies. An allergy is when your body has a bad reaction to something, a medicine, a food, or something in the air. For example, I am allergic to penicillin. And medications. Medications. Medications are the medicines you take regularly, for example, for high blood pressure or for diabetes. If you're enjoying this episode, please click the like button. It really helps us reach more English learners around the world. And please share it with a friend and subscribe to our channel so you never miss a new episode. Okay, let's keep going.
So you have checked in, filled out your paperwork, and now you are sitting in the waiting room until the doctor is ready to see you.
After a little while, a nurse will call your name and bring you to the examination room. Examination room. The private room where the doctor will actually see and examine you.
In the examination room, the nurse will check your vital signs. Vital signs are basic measurements of how your body is working. They include your temperature, your blood pressure, your heart rate, and sometimes your weight.
Temperature is how hot or cool your body is. Normal body temperature is about 98.6 degrees Fahrenheit or 37 degrees Celsius.
Blood pressure measures the force of blood moving through your body, and heart rate is how many times your heart beats per minute. The nurse will check all of these at the start of your visit.
Then the doctor comes in, and one of the most common things a doctor will say first is, "So, what brings you in today?" What brings you in today? This is a warm, friendly way to ask, "Why are you here? What is the problem?"
Right, and this is when you describe your symptoms. Symptoms. Symptoms are the signs that something is wrong with your body, the feelings and changes you notice. Let's practice some really important symptom phrases.
I have a sharp pain in my chest. Sharp pain is a strong, sudden stabbing feeling, like a knife. You can replace chest with any body part, your back, your side, wherever it hurts.
I have a dull ache in my back. Dull ache. A dull ache is different from sharp pain. It is a mild, constant, uncomfortable feeling that does not go away. Dull ache.
Here is a very useful structure. I have been feeling for something still happening now. For example, I have been feeling very tired. Or, I have been feeling dizzy.
Dizzy, diz-z, means you feel unsteady, like the room is spinning around you.
I have been feeling nauseous. Nauseous. Nauseous means you feel like you want to vomit. That uncomfortable feeling in your stomach.
I have a sore throat. Sore throat. Sore throat. A sore throat means your throat, the inside of your neck where you swallow, feels painful and rough. Sore throat.
Right, and I have a fever. 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 A fever means your body temperature is higher than normal. When you have a fever, you often feel very hot but also shivery. Fever.
I have been coughing a lot. Coughing. Coughing is that sound and action when air is pushed out of your lungs forcefully, like when you have a cold or an irritation in your throat. Coughing.
And a very important one, I feel short of breath. Short of breath. Short of breath. This means it is difficult to breathe or you feel like you cannot get enough air. Short of breath.
You can also say, I have a headache, my stomach hurts, or I have a rash on my arm. A rash is red or irritated skin.
Rash. R-A-S-H. Great addition, Brandy. Now, after you describe your symptoms, the doctor will ask some follow-up questions. Let's practice answering them.
The first common question is, when did this start? You can answer, it started about 3 days ago, or I have been feeling this way for about a week, or it started yesterday.
Another common question is the pain constant or does it come and go? Constant means it is always there. Come and go means it appears for a while, then disappears. You might say, the pain is constant, or it comes and goes. The doctor will also often ask, on a scale of 1 to 10, how would you rate your pain? A scale of 1 to 10. 1 means very mild, almost no pain. 10 means the worst pain you can possibly imagine.
I would rate it about a 6. Or, at its worst, it is about an 8. At its worst. At its worst means when the pain is at its most severe. At its worst.
The doctor might also ask, do you have any other symptoms? You can say, yes, I also have a headache and a fever, or simply, no, those are my only symptoms. My only symptoms.
And remember, Jason, the doctor might ask, are you currently taking any medications? You can answer, yes, I take, and then say the name of the medicine. Or, no, I am not currently taking any medications.
And here is something important. If you do not understand the question, just say, I'm sorry, could you repeat that please? Or, could you say that more slowly? Doctors understand, so never be afraid to ask. After the exam, the doctor will give you a diagnosis, diagnosis, the name of the illness or condition you have.
I think you have a bacterial infection, meaning tiny bacteria have entered your body and are making you sick.
It looks like you have the flu, a common viral illness that causes fever, body aches, coughing, and tiredness.
You have high blood pressure. Or you have an ear infection, when bacteria or a virus causes pain and swelling inside your ear.
After the doctor gives you the diagnosis, the doctor will explain your treatment. 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 It's the plan for making you feel better. It might include rest, changes to your diet, or medicine.
Often, the doctor will prescribe a medication for you. Prescribe. Prescribe means the doctor officially orders a specific medicine, something you cannot just buy at the store. You need the doctor's authorization first.
And the written order for that medicine is called a prescription. 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 The doctor will either give you a paper prescription or send it electronically, meaning digitally, directly to the pharmacy.
Pharmacy. Pharmacy. The pharmacy is where you go to pick up your medicine, often inside a drugstore or grocery store. The person who prepares your medicine is called a pharmacist. Pharmacist.
The doctor will also tell you how to take the medication. They might say, take 1 tablet twice a day with food. Tablet. A tablet is another word for a pill, a small, solid piece of medicine. Tablet.
Twice a day means 2 times every day. With food means eat something before taking the medicine. So the full instruction is take 1 tablet twice a day with food. And always finish your full course even if you start feeling better. I would like to run some tests. Run some tests. Run some tests means the doctor wants to collect and analyze some information from your body to help with the diagnosis.
We are going to do a blood test. Blood test. A blood test means a small amount of your blood is taken, usually from your arm, and sent to a lab to be checked.
Or the doctor might say, I'd like to take an X-ray. X-ray. An X-ray is a special kind of picture that shows the inside of your body, especially your bones. X-ray.
If you do not understand your diagnosis or your treatment, always ask, can you explain that again, please? Or what does that mean exactly? The doctor is there to help you. Never leave confused.
Absolutely. And before you leave, many doctors will want to schedule a follow-up appointment. follow-up appointment. A follow-up appointment is a second visit to check on how you are doing, to see if the treatment is working.
The doctor might say, "I would like to see you again in 2 weeks for a follow-up." And you can respond, "Of course, I will schedule that at the front desk." Or, "How soon do I need to come back?"
Schedule. Sched-ule. Schedule. Schedule means to plan a time for something. Go back to the front desk and say, "I need to schedule a follow-up appointment."
It is also really helpful to ask the doctor, "What should I do if my symptoms get worse?" Get worse means the problem becomes more serious, more painful, or more dangerous. Get worse.
The doctor might say, "If your symptoms get worse, call us right away or go to the emergency room." The emergency room, or ER, is where you go for sudden, serious medical problems. That is such important advice. Now, let's do a quick review of all the key words and expressions from today's episode. Ready?
Here is our full vocabulary list. Making an appointment. Appointment. New patient. Existing patient. Reason for your visit. Opening. Checking in. Front desk. Receptionist. Check-in. ID. Insurance card. Paperwork. Medical history. Surgeries. Allergies. Medications. Exam room. Waiting room. Examination room. Vital signs. Temperature. Blood pressure. Heart rate. Symptoms: sharp pain, dull ache, dizzy, nauseous, sore throat, fever, coughing, short of breath, headache, rash. Doctor questions: constant, come and go. Treatment, diagnosis, treatment, prescribe, prescription, pharmacy, pharmacist, tablet, blood test, X-ray, follow-up, schedule, get worse, emergency room. Wonderful work, everyone. Wow, look at how many words and phrases you have learned today. You should feel so proud of yourself. That is a lot of vocabulary, and you did it.
We love reading your comments. And remember, practice every single day, even just a few minutes. It truly makes a huge difference.
Every day, even a little bit, every single day. If you enjoyed today's episode, please give us a like and share it with a friend or family member who is also learning English.
And if you haven't subscribed yet, please subscribe right now. You'll always be the first to know when we release a new episode. Before we say goodbye, here is a little challenge for you. Head down to the comments section and write a few sentences in English about your last visit to the doctor's office. Try to use the words and phrases you learned today, like appointment, symptoms, diagnosis, or prescription. It does not have to be perfect. Even 2 or 3 sentences is wonderful.
That's right. And remember, there are absolutely no wrong answers. Writing in English, even just a little, is fantastic practice. Keep practicing every single day. Even just a few minutes makes a big difference. You are doing amazing.
Thank you so much for spending this time with us today. Keep believing in yourself, keep learning, and keep going. Take care, everyone. Goodbye.
Goodbye. See you next time on Let's Master English Together.